Right. Hello everyone and welcome to the Menter Moch Cymru webinar on the causes and treatment of lameness in pigs. We're delighted to have pig veterinary specialist Dr Alex Thomsett join us to deliver today's webinar. Before I pass you over to Alex, just to make you aware that there will be a question and answer session following Alex's presentation. So throughout the webinar, if you'd like to ask any questions, you're very welcome to do so by clicking the Q&A button at the bottom of your screen, and then we'll do our very best to answer as many of them at the end. So we'll go straight into it and I'll pass you over to Alex.
Good evening everyone, and thank you for joining us for this webinar on lameness. Just a brief introduction about myself. I have worked at the George Veterinary Group for too many years now, about 17 years since I qualified. Started off doing mixed agricultural veterinary work and moved across to do 100% pig work approximately 10 years ago, and have continued to develop in that area throughout my professional career to date. Some of you may know me from previous presentations I've done from Menter Moch, and this is the next in the series, which is on lameness. So I will start sharing my screen now and see you at the end for questions and answers. We're going to cover the causes and treatment of lameness in pigs, which are many and varied. It's quite a broad topic, and there really isn't enough time in a roughly 1 hour webinar to cover every single potential cause of lameness. I have bear with me. There we go. I have broken it down into what lameness is, what to look out for, and what the common causes are. And with each of those common causes, I'm going to cover some treatment options and also some management options. As I say, I can't cover everything in immense detail, so I've selected a few particular types of lameness and issues that you'd encounter. And if you have any other questions about anything else you've experienced, please ask it, and I will try and cover it to the best of my ability at the end. Also relevant to this is how to handle and restrain pigs in order to examine them effectively, but also to administer treatment as stresslessly as possible and also as effectively as possible. First off, what to look out for in terms of signs of lameness. I'm sure you've all experienced pigs showing various different clinical signs, but just to give you a rundown of a selection of the things that you should be looking out for. A few of them are fairly obvious, such as swollen joints, not wanting to stand, not being able to move around easily within their accommodation or outside. Some of them are a little bit more subtle, such as merely sitting in a dog sitting type position, which is not a common position for pigs to sit in comfortably. And if they remain in that position for a prolonged period of time, it usually indicates that something is making them unwilling to stand. Shaking and shivering, particularly of the limb or limbs that are uncomfortable, can be an indication that when they're weight bearing, this is very much uncomfortable for them. If it's obvious, you could identify a fracture. Usually that's quite extreme, because in order to see it outwardly, there is quite a severe fracture. Often fractures can be a little bit more subtle and will merely present as either an acute onset of lameness, so very, very sudden, or alternatively an insidious long-term lameness that never seems to resolve properly. They may merely be off food or reluctant to go to the hopper or trough in order to eat. And sows may be unwilling to accept boars at service because it is physically uncomfortable for them to bear the weight of the boar during service. And likewise, boars may be reluctant to serve, particularly if one or both of their back legs is uncomfortable, because they have to then take all of their weight on the back legs during service. If the cause of lameness is something more systemic, so not just affecting one or more limbs, then there may be other signs such as a fever associated with the lameness, which can give you an indication of what the specific cause of that lameness is. I would normally break down lamenesses into infectious and non-infectious causes, as this gives you a better idea of how to manage them once you've identified the baseline cause of disease. Mycoplasma hyacinopii is very common in all age groups of pigs, but mostly seen in growers and finishers, but also in gilts pre-service. And this causes a disease syndrome called mycoplasma arthritis, which you may or may not be familiar with. Erysipelas has many and varied clinical signs, and I'm going to go into this in more detail, but one of its manifestations can be a chronic lameness. Streptococcus, particularly Streptococcus suis, is well known for causing multiple joint swellings, as is Glasser's disease caused by Haemophilus parasuis. Something that I've been discussing this week has been foot rot and bushfoot, particularly over the horrible winter conditions that we had. We had a lot of issues with this. And a joint ill, which is probably more something we'd refer to in terms of neonatal or immediately post-wean pigs, but you can get joint ills in older ages of pigs. And then I would be neglecting my duties if I didn't mention the notifiable diseases such as foot and mouth and the other vesicle causing diseases that are notifiable in the UK that can cause lameness as part of their systemic presentation. With respect to non-infectious lameness, trauma would be pretty well near the top of my list. Conformation, so the way the pigs are physically put together may make their method of walking, their gait, look like they are lame, or may alternatively lead to lameness due to uneven footwear or unequal pressure on various joints. Hoof and foot issues, often brought on by accommodation or wet conditions underfoot, and also as a result of the conformation issues causing claw overgrowth. And again, I'll cover this in more detail. And metabolic bone disease. It's a fancy way of saying mineral deficiency, basically. And again, having an imbalanced diet with respect to minerals can lead to several different presentations of disease depending on the age category of pig. And then age and weight related issues, mostly due to arthritises and additional pressure on joints due to pigs that are carrying extra weight than they really need. So that's a reasonably comprehensive list, which obviously in this time I can't cover everything in huge detail. So I've picked out a few that I'd like to focus on that I think are most pertinent. But as I say, if you have questions about any of the others or anything else with respect to lameness, please do ask it and I will attempt to cover it. To start with, erysipelas. I cover this in quite a lot of presentations that I do because it falls into many different categories, both in terms of reproductive disease, sudden death, pigs that are lethargic and off their food. And in terms of lameness, as I've highlighted at the bottom, erysipelas has the effect of causing a chronic lameness, which is often poorly responsive to treatment. The best description of how pigs can look when affected by erysipelas lameness is an elephant trying to stand on a drum. They have quite an arched back because their feet are often quite close together and they almost look like they're standing on tiptoes. They're incredibly uncomfortable with this, and the lameness itself is very difficult to resolve. The picture you can see there is a very, very classical presentation of the diamond skin lesions, and it's probably the most classical presentation that I've ever seen throughout all my years in practice. It's unusual for it to present like this. In fact, it's more usual to present as subtly as this picture, where you have to look quite closely at the pig to see the raised red blotches, which it and its pen mates are covered in. As a general rule, erysipelas responds very well to penicillin, but the lameness has got a variable response to treatment. In fact, it often doesn't respond particularly well at all. In the case of a lameness associated with erysipelas, I would still advise attempting to treat with penicillin, but I would obviously add in an anti-inflammatory in order to provide some pain relief. In order to try and manage erysipelas, hygiene of accommodation is incredibly important. It enjoys deep litter systems indoors where pigs are in contact with manure for prolonged periods of time. And outside, it's very prevalent because it is soil-borne bacteria, and therefore pigs living outside invariably come into contact with it. I've also mentioned there that it is present within sheep and turkeys, particularly as other species that carry the same erysipelas bacteria. And therefore, if you have multi-species on your holding, it's worthwhile bearing in mind what erysipelas protection you have in place if the pigs and other species such as sheep and turkeys do potentially have indirect or direct contact with one another. Invariably, the easiest way to control erysipelas is using vaccination, and this is not particularly expensive and quite easy to achieve. And for the majority, in fact all of my commercial and smaller scale pig keepers, as a baseline, I would advise erysipelas vaccination to avoid these chronic conditions such as the lamenesses or the heart valve lesions that can be seen post-infection, and also to avoid the heartache of reproductive failure and therefore lost pregnancies, as well as the sudden deaths that can result of an acute infection in any age group of pig. Moving on to foot rot and bush foot. Foot infections are most commonly acquired from some sort of a penetrating injury into either the sole of the foot or through a defect in the hoof wall, which may be caused either by an injury or due to poor hoof quality, making it easier for infectious material to penetrate. These infections can either remain fairly simple and just affect the local area and not go particularly deep into the tissues, and would resolve relatively simply with a course of antibiotics and some anti-inflammatories to deal with any discomfort. However, they can spread much deeper into tendons and bones in the foot and the lower part of the leg, and these are much more complicated to resolve. And once they've penetrated into these structures, there is a possibility that it could go outward into the whole system of the body of the pig and cause something called septicemia, which is effectively circulating infection within the bloodstream. The phrase bushfoot actually is a colloquial term, but it refers to the bursting out of an abscess at the coronary band of the pig's foot. So once that foot infection or foot rot has spread within the foot, it finds the path of least resistance in order to burst out as an abscess, and often this occurs at the coronary band. The most common reason for foot infections for this to occur are poor underfoot conditions, and this doesn't necessarily mean wet and muddy, although the softening of the foot in wet and muddy conditions does predispose to foot infections, and also allows the bacteria that create the foot rot condition to have the ideal conditions in which to proliferate. It can also occur in hard, dry conditions where maybe there is the penetration of a splinter or a thorn or something similar that actually works its way into the sole and causes an infection because of there actually being a foreign body in the foot. And I've mentioned at the bottom that inadequate biotin, the nutrient biotin in the diet, can contribute to this, because a lack of biotin can lead to poor foot integrity and poor hoof quality, and therefore predispose to defects allowing infection to penetrate. As I've said, you can have varying degrees of infections. Mild or moderate infections can be treated reasonably successfully with antibiotics from various different categories. So it's worthwhile trying to identify, if possible, what the best class of antibiotic is, potentially by getting some bacteriology sensitivity testing done. And then in order to allow releasing of the infection and effective treatment with anti-inflammatories and antibiotics, there may be a place for foot pairing and poulticing and bandaging. But this is quite time consuming and so does need quite a lot of dedication in order to achieve a good outcome. For severe infections, the above does apply in terms of treatment options, but the response may not be as positive as in mild or moderate cases. And in the worst possible cases, as much as we try our hardest to resolve them, sometimes on welfare grounds, the damage to the internal structures such as bones and tendons within the foot is so severe that euthanasia of the animal may be the kindest thing to do, because resolution is not going to be achieved. And even if the primary infection is resolved, the underlying damage of fundamental structures within the foot and lower leg may be so severe that the animal is left with a chronic pain condition which would not be acceptable to allow them to continue with. As I've said, often these foot conditions are predisposed by the environment in which the pig is living, so managing the hygiene and the housing or paddock conditions as best as possible will help to limit. And if necessary, if those measures haven't been effective, it may be appropriate to consider some additional supplementation with dietary biotin. I understand that there have been some questions before the webinar about hoof lesions and hoof care. So I thought I'd use a previous patient of mine who was a pet pig called Mabel as an example of managing unequal horn growth, because she had feet that persistently grew at funny angles and overgrew some claws and didn't wear properly. In Mabel's case, this was caused because her leg conformation from a young pig was quite poor, and she had quite dropped hocks and therefore didn't wear her main hooves as well as she should do. She also was accommodated partly in the owner's house, as you can see from the picture on the left, and so forth. She didn't have quite as much access to the outside world as she maybe needed, despite being advised to, in order to allow wearing of the hooves by getting good daily exercise on hard surfaces. On the right hand side, you can see a selection of the kit that I use to do foot pairing, and you can tell from the picture on the left that unfortunately I had to anaesthetize Mabel in order to manage her foot problems, because she wasn't particularly keen on having her feet picked up on a regular basis, which was needed in order for her not to have significant problems. And she was quite a big girl. So I use farrier's nippers and a farrier's rasp in order to pair the feet. And looking at the next slide, you can see on the left what her back feet looked like before they were trimmed, and on the left is what they looked like before they were trimmed, and on the right is what they look like after they were trimmed. It's not a particularly quick process, but it was quite successful, and we repeated this approximately every 6 months, maybe slightly more, depending on how the horns were growing and how much exercise outside she got. Included in the trim was some moderate attention on the accessory digits, but we mostly focused on the main claws. So there are multiple different hoof lesions that you can come across, some of which we've already covered in the context of the claw lesions and the foot rots in terms of wall defects and penetrating injuries. But in terms of the overgrown claws or the unequal growth of claws, as I've commented with respect to Mabel, either muddy ground or deep litter with not a huge amount of exercise to allow hoof wear can cause overgrowth of claws. But also, if there's something else underlying that's causing discomfort in the leg or one of the other legs, there may be a change in the weight bearing, the way in which the pig bears weight. and therefore this will favour wear of certain claws over others, and therefore allow other claws to overgrow. There is a possibility there's congenital deformity, which I couldn't entirely rule out in the case of Mabel, but it's much less common. The first two are much more likely, and therefore there's a possibility of finding an underlying cause to try and rectify the issue, rather than going through the process of pairing frequently. So in order to manage those, you would obviously consider reviewing the accommodation and what floor surfaces your pigs have access to, and how much exercise they get. Often affected are boars that are kept in smaller pens or paddocks because they are kept away from sows when they're not required, and therefore don't get quite such wide-ranging exercise as maybe sows, growers and finishers do. If there is an underlying cause of pain, obviously address this. And in order to correct the overgrowth initially, whilst rectifying primary causes, pairing the feet is a good idea. And it may be necessary to repeat pairing the feet if the horn overgrowth isn't easily resolved. So moving on to the non-infectious causes, trauma is quite a common cause of lameness, and this again can manifest in many different ways. As a primary first aid, you would assess the injury, treat it appropriately according to what you can see. In this case, I've used an open wound as an example of something that could cause lameness, but trauma can manifest without seeing any open wounds. It may well be that there's been a fight within a group of pigs, and some pigs have been compromised as a result of that, and therefore left with lameness issues that might not have any physical open wounds on the body surface. I have had instances where pet pigs have been kept in accommodation with ponies or donkeys, and they've not particularly enjoyed each other's company, and there's been kicking from the equines to the pigs, and that's left some trauma on the pigs. In which case, again, you wouldn't necessarily have an open wound. It's more evaluating whether any of the underlying structures have been significantly damaged as part of the examination. In the case of an open wound, you would treat it as you would do any wound, cleaning and dressing appropriately, applying topical treatments such as an antibiotic spray or an antiseptic spray, and if necessary, a injectable antibiotic and an anti-inflammatory for pain relief on top. Often in cases that I've come across, the option to do any suturing or more invasive wound management, by the time the wound's been discovered or by the time it's been seen, it's past the point where trying to close the wound with sutures is possible or practical. And often, because of the environments in which pigs live in, it's potentially better to leave the wounds cleaned and open in order to drain any infection that might occur due to the conditions, rather than closing that wound and potentially locking anything in that then needs subsequent draining. In some cases, it may be that a part of the accommodation is responsible for the trauma, so a damaged gate or a protruding part of the pen or accommodation, a damaged farrowing arc. There's multiple different things that could potentially cause injury, and pigs are notorious at nosing around and investigating, and in the process they're quite strong and can move things about and bend them. So whilst the primary objective is to manage the trauma and deal with the injury, you also need to try and rectify what the primary cause of the injury is. So evaluating the pen environment and checking to see whether there's anything that needs to be mended or removed that could be a source of injury to the pigs in the future. So on to metabolic bone disease, or as I said, the complicated way of saying mineral deficiency. I don't profess to be a nutritionist. This is quite a specialist area, and I would always defer to someone that works in this area 100% of the time in terms of formulating rations and answering more complicated questions to do with ration formulation or mineral balance. However, I can give a rundown of what imbalanced minerals within the diet can cause, and an overview of what the actions to take initially would be. But when I'm dealing with these cases in the field, I would involve a nutritionist and potentially do some feed analysis in order to 100% get to the bottom of what might be causing problems. When we're discussing metabolic bone disease, we're mainly referring to calcium, phosphorus, and vitamin D, which all work together within the body to maintain bone integrity. As you can see here, there is an ideal ratio within the diet for calcium to phosphorus, and this is something between 1.25 to 1 to 1.5 to 1. If you go significantly above or below this ratio, there is an inappropriate level of calcium to phosphorus within the diet and therefore within the pig's body. And this can then lead to changes of the bone density due to the need of the body to balance out the ratio to where it should be by usually liberating minerals such as calcium and phosphorus from the bone structures themselves. In young pigs, this can often present as rickets, which is bendy or curved bones. Sometimes this would manifest as swollen growth plates or joint ends, and it can be quite painful. In older animals, it would manifest as a significant loss of bone density through osteoporosis, and in that case, it can particularly lead to fractures, which are known as pathological fractures, because they occur following a process in which the bone density has been depleted. In growers and finishers, it may manifest more subtly to start off with purely a decrease in growth rates. But based on recent experience with one of my clients, we have also suspected pathological fractures can occur in this age group as well. As I've said, often it's caused by feeding a diet that's poorly balanced in the minerals and isn't reaching those ratios as advised. And it's often described as being associated with homemade rations that have not been discussed with the nutritionist necessarily specifically, and therefore might be missing some of those fundamental minerals. It's not a problem to make a homemade ration, but it's always worth discussing what raw materials you have available to you, and if there's anything that might be lacking that then needs mineral supplementation, which can be purchased individually. Primarily, if it's suspected, the first thing to do is identify and address what the deficiency is. It's not a given that you would be deficient in all of the particular minerals. It may well be one that is then throwing everything else out of balance. If the diet's deficient and you can replace it with a more appropriately balanced diet in the short term, then you should stop feeding it. Alternatively, if you've established where the deficiency lies and you can supplement it, then doing that would then redress the deficiencies. It might be prudent for any of the affected individuals, if you've got clinical signs of disease, to be provided with supplementary minerals individually. But again, as we've talked about in other conditions, particularly if you have pigs that have experienced pathological fractures that are not healing and are leaving them in chronic pain and discomfort, there are some cases where euthanasia on welfare grounds may be required. The primary management tool is to make sure that whatever diet or ration is being fed to the pigs is properly balanced. And I would always advise some form of discussion with a nutritional professional before you embark on making homemade diets, and potentially lead to problems which in fairness are not 100% metabolic bone disease. Poorly balanced rations can lead to issues with poor fertility and poor performance, but the extreme presentation of mineral deficiencies is obviously pigs going off their legs and fractures, which are distressing for everybody, especially the pigs. So it's always worth consulting some sort of nutritional advice before embarking on what diets to feed your pigs. as we said at the beginning, it's impossible to cover everything in vast detail. So I'm going to pause there in terms of the causes of lameness and move on to the methods of handling and restraint of different age categories of animals in order to be able to examine them and also administer treatment. This isn't purely with reference to dealing with lameness cases. These handling techniques are appropriate for all methods, all examinations, and also all times when you would need to treat your pigs. Restraint may be required for a clinical examination, such as when you have a vet coming to see your herd, or if you wanted to examine an animal to evaluate whether there was an injury or a wound that needed treating. If samples need to be collected, such as blood samples or fecal samples, but also potentially looking for mange or lice, in which you want to collect some skin scrapings, might be an example. The administration of treatment, and in certain situations, it may be necessary to handle an animal and restrain it to carry out husbandry procedures, such as foot trimming, which is pertinent to the topic tonight, but also shortening of boars' tusks that have got too long, and various other interventions, some of which would involve a veterinary surgeon and some of which you'd be able to do yourselves. The key with handling facilities is that you don't give them the pigs too much room to run around in, because they will do exactly that. So somewhere secure, somewhere small and enclosed, and somewhere that's not likely to cause any injury to either the pigs that are being restrained and examined or the people attempting to do the examination. And obviously optimum lighting is necessary, because once you've restrained an animal to examine it, you need to be able to see what you're doing. Likewise, to administer treatment, working in the dark does not facilitate a positive outcome. A lot of pigs are kept outside, and the first question is what do I do with managing pigs outside in terms of handling and restraint? Some have access to some form of solid floored area with a small enclosure, and that's useful in terms of being able to effectively handle and restrain animals. And also, if the underfoot conditions are boggy during a winter like we've just had, obviously trying to do anything outside where both you and the pig are struggling to move around because of the depth of mud makes life quite challenging. So if there's a solid floored area, it's much easier for everybody. However, if there is no solid floored area, creating a small corral at the corner of the field, either a temporary or permanent structure, would be useful, so that most of your time isn't spent following a pig around a 7-acre paddock in an attempt to try and administer one injection. It's quite stressful for the animals, and it's certainly quite stressful for the people. So having something prepared that you can corral them calmly into a smaller area and therefore release them after treatment will be much less stressful for everybody. Just as a point of experience, over the years, I've done many and varied things in terms of trying to treat pigs on all scales of production, and crawling inside an ark is not a very safe way of operating. I wouldn't take this as an acceptable small enclosure, because it's quite dangerous for the person, and it is the pig's place of solace. So you're sort of invading their space, in which case their response is going to be all the more dramatic. It's worthwhile having somewhere with much higher roof and much slightly bigger than a farrowing ark as a method of restraining the pig. What you choose to do is very dependent on how big the pig is that you need to examine. You can well imagine that a 7-kilo piglet is much easier to catch and pick up than a 70-kilo finisher, and therefore you have to have equipment appropriate to different age categories. One of my colleagues and some farming friends from way back before I went to vet school would always say the 7 Ps are vital in terms of a good outcome, and that is proper planning and preparation prevents pretty poor performance. Basically, get it all set up first and you're going to have a good outcome. go and wing it, and it's likely to go a little bit wrong. Multiple different pieces of kit that are useful to have. You don't necessarily need all of them, but a mixture of the above will help with most categories of animals. Pig boards, most people have had experience with this. Doesn't have to be anything fancy. Could be a reasonably thick sheet of ply with some hand grips cut into it. These are very useful for restraining pigs in small areas, blocking exits, and just generally allowing you to get a pig into a smaller enclosed area without using any physical intervention. Some people do have crates of varying different reasons, weigh crates or service crates, and these can be useful, although you have the caveat that you don't want to put your hands in between bars if you're examining things in case you get your hand stuck or injured. And as you can see from the picture, using a snare to restrain the pig from the snout, although it looks not particularly nice, it tends to be quite a quick way of restraining an animal, and because they stand virtually motionless whilst on the snare, you tend to be able to complete what you're doing very swiftly. Therefore, despite the fact they make quite a lot of noise because they resent being restrained, not because it's particularly painful, it does mean that the whole procedure is over and done with super quick, and therefore overall limits the stress. It's always one that I discuss before I use it if people aren't familiar with it as a technique, because it can be quite noisy and people don't always know what to expect if they haven't seen it used before, but it is very effective as a method of restraint. I've mentioned crowding, and this is a technique that can be used to vaccinate significant numbers of pigs at the point of weaning, for example, where you don't actually physically handle any of them. You keep them in a group in a relatively small area and move through them, administering vaccine, purely using the number of pigs in the area as a method of limiting how far they can roam around and therefore allowing you to achieve treatment. Obviously, if you're interested in one single animal in order to examine it, this isn't an appropriate method of restraint in that particular situation. So for pigs less than 10 kilos, it is still acceptable to arrest a pig's movement by grabbing a back leg, but then lifting them from the floor by supporting their chest. You wouldn't swing or snatch a pig using one or both back legs, as this can cause some injury potentially to the legs, which might be more significant than the reason you were catching them in the first place. So supporting them by the chest against the body and then replacing them on the ground after you've finished. The picture is an example of how we would collect blood from this age category of pig, because they're so small that it's quite difficult to do it whilst they're actually on the ground. And this is provided by one of my colleagues. Once they get over 10 kilos, it starts getting more difficult to physically restrain them in your arms, and is hard work if you have to restrain more than one animal. Therefore, we move into the use of pig boards to squeeze them into a small area, applying pressure to the flank or the shoulder in order to be able to stop a pig moving backwards and forwards easily, or using a snare. As you can see from the picture here, my colleague Annie is reducing the size of a tusk in a boar whilst he is on the end of the snare in order to reduce the chances of him injuring either other animals or stock people, because he has extra long tusks. The equipment you might consider using: pig boards, snares. If you're using snares particularly, but in most instances I would advise some sort of ear protection for the people doing the handling, because pigs are quite noisy when they're being restrained. And quite often bribery with food works quite well. I have a number of clients where putting a bucket of food in front of the animal I'm trying to examine is sufficient, no need for boards or snares. Happy with the head in the trough and you can get on with most things without them even lifting their head to see what's going on. An injection toolkit's worthwhile putting a bit of time and effort into thinking about what you need. And you can see in the picture, I've got an example of a repeat vaccinator gun and also something called a slap shot. These are tricks of the trade to help making injecting pigs slightly more simple than just a needle and syringe, which are often prone to bending and breaking if pigs are not happy with the process that's happening. Again, we've discussed the suitability of the handling area and some appropriate methods of restraint. Both of these are vital to achieve a good outcome of trying to inject a pig. If you're chasing a pig around a field with a needle and syringe, either it's not going to get the injection it needs, or it's going to get some of it and the rest may well get squirted somewhere else. So having the animal properly restrained in suitable accommodation for that is going to make sure that the animal gets the correct dose in the right area of the body, and that is completed in as stress-free way as possible. To explain, the slap shot is an extension tube, or a flexible extension tube that runs between either the needle or the vaccinator gun, the needle and either a syringe or a vaccinator gun. It's approximately 1 meter long, and it just gives you a bit of play if you've got a pig that's a little bit more timid and is less keen on having you stood next to them whilst you're completing either the vaccination or the injection. And it allows you to put the needle into the appropriate part of the pig's body, but then follow them if they move and not be right next to them whilst you're injecting. And vaccinator guns are not necessarily purely for administering vaccines. You can have a larger volume calibration, and this might allow you to give antibiotics, and it gives protection for the bottle so that it's not likely to get broken. And if you've got more than one pig to inject, for example, this might be an easier way of doing it than running around refilling syringes when you're in the middle of the pig pen. Picking the correct size of needle and the correct length of needle is quite important, partly for the age and size of the pig, because using an extra long, super thick needle on a tiny piglet is not particularly fair and potentially could cause more damage to deeper structures because the needle penetrates further into the pig than it needs to. And likewise, using a short, stubby needle in a large sow, boar, or finished weight pig may well mean that the product isn't delivered in the correct part of the body because it doesn't penetrate far enough. So this is just a bit of a guide as to the needle size that is appropriate for the age category of pig, and you can see the gauge of the needle decreases as the animal gets older, and that's because the bore or the size width of the needle increases in order to allow you to inject effectively. Often you may need to select an appropriate gauge of needle according to what you're physically injecting, because some of the products may be slightly thicker. Some of the white antibiotics are often quite thick and gloopy, therefore a wider bore needle is more appropriate in order to make sure you get effective injection without too much back pressure in the syringe. Just as an example, the recommended area in which to inject a pig is in that triangle that's highlighted behind the ear in front, and I use the landmarks of the back of the ear and the front of the shoulder and just below the top line, so you avoid any structures of the spine. And this is an appropriate area for both intramuscular and subcutaneous injection, so into the muscle and into the skin. The difference in the way in which you approach the pig is that to achieve into the muscle injection, you would approach with the needle at a 90-degree angle to the pig's skin. And to achieve a subcutaneous injection, you would be at approximately 45 degrees to the skin. It will tell you on the product data sheet or the slip of paper that comes with whatever you're trying to inject, whether you should administer the product into the muscle or under the skin. And it's worth reading these before you administer to make sure you are actually applying the product into the correct area. So you can see from these pictures, this highlights your perpendicular or 90-degree injection for intramuscular and your 45-degree injection for subcutaneous. And you can see from the pictures why you would use these different angles in order to make sure that you do actually inject into muscle rather than just depositing underneath the skin. And likewise, making sure in a subcutaneous injection that you don't inject into the muscle and you do deposit whatever you're giving under the skin. So to recap, in order to get effective injections, you should use the correct drug at the correct dose, but you must select the right needle length and check where to inject. And in this particular picture, this is an example of injecting intramuscularly. You can see the landmark behind the ear, below the top line and in front of the shoulder. So to summarize what we've covered in the webinar this evening, we have covered how lameness presents with a variety of different clinical signs, that there are many different causes of lameness, some of which we've covered in more detail than others, that there are treatment options available for most causes of lameness and some prevention strategies which you can utilise, and that utilising appropriate handling techniques facilitates effective treatment. And I thought I'd dig out a picture from my archive that's quite appropriate for the current health climate. This was taken by a friend of mine that lives in Australia when the swine flu broke out in 2009. They have some brass statues in Adelaide town centre, and someone with a sense of humour went round and put face masks on all of them, but I thought it was quite appropriate. So thank you very much for listening for the last 45 minutes, and now's your opportunity to quiz me. Thank you very much.
Oh, Alex, I think you just need to stop sharing your screen.
Okay.
If that's possible.
Hello.
Hello, there we are. Brilliant. Well, thank you very much, Alex, for such an informative session and for covering so much and so many practical ways to help us identify and treat and manage lameness in pigs. Briefly, before we move on to the Q&A, I'd just like to mention a few things that may be relevant to you that, well, available through the Menter Moch Cymru project. Firstly, we've got 2 other webinars coming up that have been confirmed. So dates for your diary. We have on the 24th of June at 6:30, we have management of sows, gilts and piglets around farrowing, and that's been delivered by Richard Hooper from Harper Adams, the livestock manager and unit manager there. And we also are delighted to have Alex back with us on the 16th of July at the same time of 6:30, and Alex will be covering managing pigs in hot weather. So we're really looking forward to that one as well. Also, if you've not done so already, we do have a resource hub on the Menter Moch Cymru website, and there's a wealth of information there for you. We have fact sheets. We also have a new technical monthly article. So the next one will be up there over the next few days. And there's also a load of other resources and free farm materials for you. And finally, just to remind you as well that the project does provide funding available for herd health plans. So there's heavily subsidised funding available for you to have a vet develop a bespoke herd health plan for you. If you'd like any more information about these or anything else that the project is doing, then feel free to get in touch with us. There is a contact us page on the website, so you've got all of our details.